Canada's vaccine supply is getting its own shot in the arm. Health Canada approved a fourth vaccine for use in the country today, and Pfizer is sending millions more doses sooner. Here is what you need to know. The newly approved Johnson & Johnson vaccine requires only one dose. The other 3 vaccines approved for use in Canada do, of course, require 2 doses. Canadians now have 4 different vaccine options. Canada ordered 10 million doses of the Johnson & Johnson vaccine with an option to purchase 28 million more. Another big development, Pfizer is pushing up shipments slated for the summer months and pledging to deliver them this spring. That means an extra 1.5 million doses will arrive this month, and 1 million additional doses are coming in both April and May. According to the federal government, Canada is on track to receive 36.5 million total doses from all approved suppliers by the end of June, and a total of 117.9 million by the end of December. Procurement Minister Anita Anand is in charge of buying Canada's vaccine supply. We reached her in Oakville. Hi there, Minister Anand. Certainly a lot of news on the vaccine front today. More shipments of Pfizer coming this month, the approval of Johnson & Johnson, which we know is at least 10 million doses over the longer term, other doses of Pfizer being bumped up. Why not move up that September timeline?
Well, hi, Catherine, and thanks for having me on. And it is a very good question. As you said, a good news day on the vaccine front. The fourth supplier approved, indicating the importance of Canada's diversified approach to vaccine procurement, multiple vaccines in our portfolio. And as well, we are receiving now 8 million doses of vaccine prior to the end of Q1, 36.5 million doses prior to the end of Q2, and overall 118 million doses in total prior to the end of Q3. And so the question about moving up the timeline is an important one. And I will just say, from a procurement standpoint, we have had some good news today and in the past weeks, 1 million doses this week or thereabouts, and close to 1 million next week as well. And the important thing to remember is that supply chains in this global environment where competition for vaccine is very intense remains at a high. And I am reluctant to assure the moving up of a delivery timeline until we can be 100% sure that our deliveries are coming in. And so we are looking very good, but we have to be confident in terms of our deliveries. And we've seen manufacturers make decisions about retooling their plants. And indeed, that's an important thing to remember. These global supply chains are still volatile, and we are protecting our vaccine supply chain every step of the way. 8 million in Q1 is the news for the day, and I think we should focus on that.
Well, listen, I mean, I think we all saw you grinning during your answer there, that there's a lot that you're happy about today, but I also think we should all take note of what you're saying about concerns about making sure all of these doses actually get here. The fact that all these doses are being moved up, we keep hearing you and the Prime Minister talk about assurances and the conversations that you're having with the companies. Are we not paying extra to get these doses moved up as well, though? Is that part of the arrangement?
We are not paying extra to have these doses moved up, Catherine. These are decisions that the supplier is making based on our negotiations and our push for additional doses earlier. There's no question there's more work to do. We are working on this file every day to make sure that we have as many doses moved up as early as possible. And today's announcement of 8 million doses in Q1 is an example of the results of those negotiations. And of course, we have to remember that Pfizer also moved 2 million more doses into Q2, 1 million in April and 1 million in May, for a total of 36.5 million doses of multiple suppliers prior to the end of June. Mm-hmm. And so we are on track. We are exceeding our expectations for Q1, but we have more work to do, and we are going to make sure we have 36.5 by the end of Q2 and 118 million by the end of Q3. Much more work to do, but we are in a good space.
Part of that work is finding out and then letting Canadians know when those Johnson & Johnson doses are going to start arriving. Obviously, that's one of particular interest, given that it is just a one-dose vaccine. So you said sometime in Q2. When are you going to be able to tell us, do you think, when those doses are going to arrive in the country?
Well, at a high level, Catherine, my goal is to make sure that all Canadians have access to vaccine as early as possible. And the goal of having multiple vaccine suppliers in our portfolio, Moderna, Pfizer, AstraZeneca, Johnson & Johnson, puts us in a place that many countries are not in, frankly. Many countries did not choose to diversify their vaccine portfolio. And so we are in a place where we're going to be receiving doses not only from Pfizer and Moderna, but also from Johnson & Johnson and AstraZeneca. Those doses will be arriving in Q2 and Q3. Mm-hmm. That's what our contract says. And we are working with the suppliers right now on obtaining a delivery schedule, which we expect in the near future. And we will share it with the provinces and territories as soon as we receive it. We understand the importance of transparency in terms of providing those delivery schedules. And as you know, we have been doing that with Pfizer and Moderna and the serum doses to date. And we will continue to be transparent with the provinces and territories when these 10 million doses of J&J and 20 million doses of AstraZeneca are allocated in a delivery schedule.
We had the Moderna Canadian manager on this program on Monday. She did not rule out further shipment delays for the Moderna vaccine. What would you say to Canadians about that?
I would say that in our conversations with Moderna, we have received assurances that they are on track for their quarterly deliveries. They have given us no indication that there are supply chain or production line bumps to be expected down the road. We are expecting our shipments of Moderna. And at the same time, we do understand that global supply chains are stretched, and we'll continue being engaged with our suppliers every step of the way so that if any bumps in the road arise, we are able to alert the Canadian public as soon as possible. But at the current time, we are working in unprecedented circumstances to receive vaccines to Canadians, and the fact that we are receiving 8 million vaccines in Q1, 36.5 in Q2, 118 in Q3 is good.
Well, yeah, let's talk about that big number for Q3, the 118 million. I apologize for interrupting, but our time with you is finite. Obviously, that sounds like a lot more vaccine than we need. So why is Canada still taking doses, for instance, from the COVAX program, when we know that that program in particular was created to make sure that countries that are in much more dire need can access doses? Would we think about backing off that, taking out of that arrangement?
As our government has said, our priority is to obtain vaccines for Canadians as early as possible. At the same time, we are committed to sharing vaccines with the developing world. And that commitment to multilateralism is found manifest in the COVAX facility, where we are one of the highest contributors, contributing over $440 million to that facility. We will share doses with the developing world, and we will continue to be committed to multilateralism in that pooled procurement mechanism of COVAX. And we will continue to make sure that we have vaccines coming into Canada while in the long term making sure that we share those vaccines with the developing world.
But I hear you saying we're still going to draw from COVAX.
At the current time, we are entitled under our agreement with COVAX to draw down on that commitment that we made with them back in the summer. And we will continue to work with the facility to make sure that we're supportive of the agreement that they put in place. And I want to remind everyone that COVAX facility was an attempt to ensure that vaccine nationalism, the kind that we are seeing in different parts of this world taking hold, doesn't occur. And so, by all means, we are committed to the COVAX facility. And as I said, one of the largest contributors to that facility, and we'll continue to support it.
Well, but some observers have accused Canada of that kind of vaccine nationalism. So I'd like to end by asking you, given that number that you're putting out there, 118 million doses by Q3, much more than we need, when would we expect to see Canada actually start to give away doses from its own supply?
We are going to make sure that all Canadians have access to a vaccine. That's our priority. That's our role as a federal government. And we will then make sure that we are sharing vaccines with the rest of the world. And I will say that motivates us every day. We know that no one is safe unless everyone is safe. And that is a message that our Prime Minister and our cabinet as a whole has made. And we will continue to support multilateralism in procurement until that goal is accomplished.
Okay, we're going to have to leave it there for today. Thank you for your time, Minister.
Thank you so much, Catherine. Take care.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.